What's going on, y'all? So we're gonna do this chat now, and we're gonna go over a couple of things that we need to go over. But there are some little extras that I found for y'all, and that exam up there is one of them. So this is your integumentary class. We already started integumentary a few days ago, and really we're just kind of finishing up integumentary. So in this class, you should have your books. You should have your books. If you don't have your books, they are below. Okay, they're below in links. Okay, I did send you guys a test or two just to see if you guys can actually get it. Okay, so here, this is one of your exam. Okay, this is actually Sapphire Academy exam, but I wanted to show you guys actually what it looks like. So I figured out a way to actually upload these exams or anything else that I want to upload. Okay, so I'm just pretty much showing you this because this is one I uploaded to somebody. I wanted to see if it actually would upload and you guys could actually open it. So I didn't put it below this one. I put it on another chat. I think it was a chat before this one. So you guys can go ahead and take a look at that. Okay. But this is it. I'm not going to go through the whole exam, but this is one of the exams that I put up there. This is the Sapphire Academy exam. This exam is like a HIM, Health Information Management. It's something that if I'm hiring a coder, I need to see if she can pass this exam, whether she has her CPC or not. If she has applied for the position and she's getting ready to take her CPC, yes, of course, she can put in for the same position. Okay. Now, this is one of the exams, and I put this on for y'all. Hi, Sean. I put this on for one of you guys to take this test. Whenever you get ready, you can take this test. I put it on link and I did test it. So I sent it to administration to check it out to see if they were able to open it with no issues. The only issue was I had to give you permission to open it. So then we did it again. Then I gave permission, and then they were able to open it. So moving forward, I'm probably going to figure out what I can send you and what I can't send you. Now that depends on you. Okay. So YouTube, if you say, Miss Lambert, send me a test or XYZ, I can create a test for you. I know AI is amazing. Listen, there's a system. You can just type in what you want and they literally make tests for you. That's how easy it is. I mean, I don't know about the other YouTube, medical billers or the coders. I'm not sure how they do their tests. Some of my tests I do make up physically, but then there's some that's pretty much generated. So in the medical billing, I have several tests. I have several exams that they take in the Sapphire Academy. But this, I just wanted to make sure that I showed you this. When you see me put links up, you guys can kind of hang out with this. You can also um, I mean, if you're in another school or whatever, it's fine. If you want something to kind of test yourself, that's fine. But your instructor in your school, she would normally have something for you to exercise on. But again, and this is one of Sapphire Academy exams, and you guys can mess around with it. Okay. I did put one in a link. If you cannot open it, let me know. If you're going to take it, let me know. Um, I'll go ahead and put it up again. So again, this is one of the exams, okay? And I think you guys can do it. Um Sometimes I take stuff from this and put it on YouTube. Okay, to see who can take it or who can or whatever. So there's no answer to this. I have to grade this. I have to give you the answers for this. You can give it back to me. If you take it, you can give it back to me. Okay, but I pretty much attached this so that you guys can go ahead and take it. Just to kind of get your feet wet. So some of y'all who have not experienced the coders, or maybe this is new to you, you may not be able to do this. But some of you who do have that more experience or have had hands-on, you probably will be able to do this exam. So again, I have figured out how to upload things for you guys. And this is one I went ahead and uploaded for y'all. This is one like I said, I use this one for hiring. So there is one that I have that's open and close. But let me see how people might do with this. I mean, you may like it, you may not. Okay, so that's for y'all. Okay, check that link out in the other chat. So this is SOP, okay? And this is for some people who are new, who might have missed this part. Whenever I have my class, I always have an SOP that you guys have to review. So like I said, in YouTube, I'm trying to expand a little more in YouTube to give you guys more. So besides that exam that I just put up there, that's the SOP for YouTube. So I'm gonna put this back so you guys can see what it is. So that's the exam, okay? So I found out how to put that in a link for you guys to take, okay? This is your SOP. This SOP is pretty much this is how it is. In my class, they have to know what's going on. So in the Sapphire Academy, it's the same thing. So even though you guys are on YouTube, you still need to get practice. You still need to get practice. So again, watch out for that link that I put down there. I put 2 links down there. Okay. So I put this link and I put the other link. And this is just to kind of let you know what should be going on in Sapphire Academy YouTube, not the regular Sapphire Academy. Okay. I'm trying to incorporate more of the Sapphire Academy into YouTube. So yes, I have figured out a way to give you exercises. Now, those of you who are in medical billing, the medical billing is a whole different pinnacle. Okay, your test is totally different. So just like how this is, I'm gonna take this down. Just like how this test is, the medical billing tests are the same way. I mean, they're pretty much in almost the same format. I don't know if I put one on there for you, but I'm going to find one so I can show you. When you see the links down there, those are exams that I have given you. If you can do them, that's fine. If you want one from me, just DM me and I'll send you something. Because you guys, coding, you have to do coding over and over and over for you to get used to doing the coding. Okay. So again, that's the standard operation procedure for Sapphire Academy. Okay. My next question to you guys is, if you guys have not got your book, go ahead and hit those links below. The books are there. You guys know we do step by step. Okay. Where's my phone at? We do step by step and all your coding books. I'll find my phone. And here is where we're going to do our review. I'm using a StreamYard today because, between StreamYard and OBS, they're both totally different. And sometimes I can do more or less on StreamYard than I can on OBS. Okay. So again, this is the SOP for Sapphire Academy. So like I said, I figured out a way to give you guys more work, but I wanted to kind of give you a little inkling of how we start off in Sapphire Academy. They have to know how Sapphire is organized and how we start off. Okay. So that's the reason why I put that up there. I'm going to take this down. And only reason I'm gonna put this back up here just to see, let you guys see if there's somebody who wants to do it. Let me know. Okay, this is the test. Okay, this is for YouTube. Okay, now Sapphire Academy does this too, but I figured out a way to give YouTube tests and paperwork and YouTube. You remember that other thing I said I was going to give you guys to put your answers on? I figured out how to get it up here. All you're going to do is download it. Okay. All you're going to do is download it. I'm going to go in here right now. Okay. Let me get in here. All right. Let me get in here. Let me open this up. Share. Okay. I'm back. Okay. This is it. So whenever you guys go into my chats, just make sure that you show. just make sure that you open up my chat panel. I always put stuff in the chat panel, okay? And if you want to take it to look at the website, you can. So the goal is to get, well, I don't know why that's in capital, but we're going to leave it. Okay. The goal is to get you guys a little bit more savvy with the coding on YouTube. So again, a lot of times I take stuff from this test and I put it in the post for you guys to go ahead and do. Okay. To kind of give you guys a heads up on something. Okay. So, you can practice something. I'm going to take that off, then I'm just going to put this here. Okay. So today we're going to go ahead and finish with Integumentary. So you guys have your book. Make sure that we are all on the same page. So you guys are probably already finished with Integumentary. We were just coming out of the guidelines. Okay. If you don't have your step-by-step book, look below and there should be a link down there for your step-by-step book. If you don't have your step-by-step book, I'm going to put the link up there. All right, let me find it. Okay, so these are the links. Okay, here's your CPT of 2026. In case somebody wants that, I'm going to drop this right here. Okay, that's your CPC 2026. That is that's the ebook. Okay, so let's drop that down. Let's put that up. So that link right there, if you want it, you guys can go ahead and click on it. If you decide to go ahead and get that from Kindle, that's fine. But they give you like at least, 35%. Okay. So that's what we're working with in this classroom today. I'm going to drop the step-by-step book down there. So the step-by-step book 2026 is this one. Okay. I'm going to go ahead and put that up. Okay. There you go. So that's the 2026 right there. So that's the CPT 2026. And let's get rid of that. That's the step-by-step 2026. Okay. And let me go ahead and get you guys the workbook. So this is pretty much what we're working in today. Some of you who have came into my class that are new, and maybe you don't have your book. This is a 2026 workbook. That's a step-by-step. Okay, so I'm going to take that down and let's put that up for show. Okay, that's your workbook. And that's the 2026 workbook. Okay. In your integumentary system, it'll be pretty easy for you guys to do because we've already went over a lot of stuff that's in integumentary system. Let me go ahead and put the Elsevier up here. And then we can kind of continue. So you guys have seen this several times. You don't really need to see that book, step-by-step book. Once you hit that link, you should be right there. What's my code? 500 873. All right. So in a step-by-step book, everybody should be on the same page in your step-by-step book. Now, we just came out of the surgery section and the guidelines. Okay. Pop that back up there. Okay, so we just came out of the surgery section and the guidelines. I'm just dropping mine up, that's all. Did you guys get a chance to get to Amazon and get that ICD-10 book 2026? It was on sale for $79, then it went to $69, then changes. I told you, Amazon, when they drop something on Amazon, they take it off and change it real quick. All right, so the surgery guidelines and general surgery, that's where we're at. Okay. So if you guys are on that same page, you guys let me know, okay? Somebody asked me for the AAPC. Okay, AAPC is just aapc.com. Okay, and you also can get books from there. That's the step-by-step workbook. So some of you who are working alone, okay, all you need to do is get your 2 hours and focus. Okay, so like I said, the test that's up there should be a link below. If not, the link is on the site. So some of you, like I said, who are coders already, you want to test your skills, go ahead and get that one. Let me take that down from there. Show hide current. Yeah, I'm trying to hide. Okay. So, like I said, some of you who are coders already, if you want to mess around with this, go ahead. You can. All right. So in this sector, let me go ahead and share screen. No, that's not what I want to do. Books, step by step. All right. So you guys should be able to share my screen. And this pretty much is just to show you where we're at. You guys already have this. We did this already. We're just kind of taking a look at it. And that's pretty much it. Then you guys are going on to Integumentary. Okay. Let me just kind of go up a little bit. So if you've got an ebook, it should be page 358. Okay, page 358 in your ebook. And we did surgical package, we did separate procedure, we did all of that. Okay. Let me get back over here. If you do have your book, you guys can take it out now. All right, let me just get up here for a second. Okay, the next thing is your CPT book. If you don't have the CPT book, look on the bottom, okay, and get that link down there. Okay, get the link down there. It's going to say CPT, the one I just gave you. This one. So make sure you put that link back up there, okay? And when you get to those links, you can literally save them. If you feel like you want to buy that book, you can buy that book. Okay, that one I think is 137. But again, you remember I told y'all, when you see alert, when I do some kind of alert, that means I'm in the car, I'm somewhere, and I got to tell y'all this XYZ. If I see a book for $59 or $69, yes, I'm letting you know. Okay, I'm letting you know. Okay, so I'm not gonna pull my I don't need to put my book on screen. You guys can do it. Do that without me. I'm just gonna go get my Elsevier book. So we did special reports, separate reports, surgical package. Okay, pretty much your guidelines for that. We did introduction to surgery section. Okay, you guys should have gone through the surgery section one by one, 10,000 series, 20,000 series. Okay, one by one. If you do have your step-by-step book, pull that out. And we've already went over the series of what the series are. Okay, and each section of this book. Okay. So you guys, if you have the ebook, that's fine. If you want to get the hard copy, you need to get the hard copy. I would prefer you to just jump out and get the hard copy rather than the ebook. Okay. So, and I was trying to hold off until the rest of y'all got books, because I'm using both the hard copy and the other one. Okay. So, in your CPT book, okay, you should have already looked at from page 1, because you guys know when I start the CPT class, I mean, y'all got to backtrack on some of the stuff that we did. Go over your CPT book page by page. Your first encounter, place of service codes for professional claims. This will go on the 1500 claim form. I do have a chat with that in there. If you're in the Sapphire Academy, you already have a 1500 claim form. There's a sample of the 1500 claim form in Sapphire Academy. Okay, let me get back in here. Okay, there's a claim form in there. So in your CPT book, those of you who are new to coding, if you can't handle that you see up on that screen, then you need to pop out your CPT book and you need to follow me right now. Place of service codes and professional claims. I want y'all to read every single one of these, okay? Because these place of service codes must go on the 1500 claim form, okay? The 1500 claim form must be filled out in its entirety, even though it is in a computer system, okay? Your most normal claim form that you're going to use in the hospital is 11. And I don't have my regular glasses on, so don't ask me to read that. So go to 11, office. Okay, then you're going to read that. 03, school. This is the place of service. Okay, y'all, that's where I'm at. So if you're looking at that test that we got up there and you feel like, you're not able to handle that one, all right, I want you to start from here. You see where it says place of service? That's where you should start. Open your book from right there. So the main one that you're going to use in the physician office, of course, is going to be 11. And the school is going to be 03. That's the place of service, right? So you got the place of service code, you've got the place of service name, and you got the place of service description. Okay. So if you guys just got your new CPT, that's where I want you to start at. Okay. So basically what you were supposed to do is look through your CPT book page by page. Even though we're only up to Integumentary, but we are getting ready to start the advanced classes. So I've been lagging on with the surgical guidelines, making sure you guys have read this book and the guidelines. Read also about CPT. On your CPC exam, I think if you all know the reason that you must pass the CPC exam is they need to know that they're finding out to see if you've actually went through your books page by page, if you know how to go through your books, if you know what's in your books. CPC will give you a question about CPT. They might find a question in CPT guidelines and say, what's this? The about CPT section, read that. Okay. As far as the advisory committee, you don't need no. Okay. They're not going to ask you anything about that. Once you get to your content, go through it. Go through everything that is on here. Evaluation and management, anesthesia. What you're doing is you're getting yourself used to looking at what's in this book. That's what you're doing. Because on your CPC exam, they need to see that you are clear on what's in this book. A lot of times people read and they're just reading. Boom, I'm finished. No. If you're reading and then when you finish reading, you don't get it. What? Read it again. If you don't get it the second time, read it again. And that is because you're not taking in the information. I personally have to read something 2 or 3 times before I actually get it. Okay. Everybody's different. Okay. But as you go through the contents, okay, don't forget, I want you to start from the beginning to the end. So your first page is contents, introduction. Okay. Because you guys know we've been working in step by step. Okay. I have not pulled out the CPT till now. We have been working in the step by step book. Okay. Right now, you need your CPT book, okay, and you need your CPC guide, okay. We are in the advanced class. To some of you who have missed a lot of that, you're going to have to backtrack. All right. So you're going to go through contents, introduction, okay, illustration, anatomical, and procedural review. Crucial. Very, very crucial, okay, that you go through that section, okay. Evaluation and management, we did. That was a long section. Okay. We went through that already. Those of you who missed that, go back over that. Okay. Anesthesia guidelines, we went through already. Anesthesia, we went through already. Okay. Backtrack and find those chats, y'all, if y'all want those classes back. We are now in the advanced classes, and it's time for you to have your CPT book. Okay. You must have your CPT book for this portion. So I've been kind of dragging around to make sure you guys get it. Okay, so surgery guidelines. We just finished with the surgery guidelines. Okay, you guys already know all about the services, CPT, follow-up, unlisted procedures. Okay, surgery. Okay, General, we already did that. If you guys missed those chats, go back over those chats, no problem. Okay. Here we are right now. If you guys get lost, here's your schedule. I think I took that one down. YouTube. YouTube, you can go on my website and you see this schedule on there. I know, I hate these little background things. Okay, this is the schedule. Okay, that's the schedule. And the schedule is going to tell you where we're at right now. YouTube, you're going to have to go to my website and look at the schedule. But this is the schedule right here. This schedule tells you where we're at. And where we're at right now, we're in the surgical section. We did general. We did surgery guidelines. Okay, we are up to the integumentary system. Integumentary system class is SPC6109. Okay, so integumentary system, musculoskeletal system, respiratory system, cardiovascular, hemic and lymphatic system, mediastinum system, diaphragm, digestive system, urinary system, male genital system, reproductive system, intersex surgery, female, maternity, endocrine, nervous, eye, ocular, auditory, and operating microscope. Every single one of those we are getting ready to do. So this is your advanced portion of your class. No, we don't go through step by step like we do in Sapphire Academy, but we just went over the same thing in the same process that we do in Sapphire Academy. You will be also put in that same place. The difference is you just don't have as many hours as they do. They have 9 to 2. You have 1 hour, hour and a half of me to kind of give you something to put you in the right place, okay? In your CPT book, the only thing that's going to give you a fickle in here, which is not the surgery section, okay, is radiology, pathology, okay? I think medicine might give you a little bump, but I think it's okay. But again, in the beginning of your CPT book, you're going to flip from page to page, okay? And this is giving you an idea of what's in your book, okay? So you guys really generally already did integumentary, but I want you guys to still go through your book. If you don't have your book, hit one of those links below. There's a free book in there. Is that the CPT? Yeah, there it is right there. I put it up already. In that CPT book that I just, if you guys can't hit that thing on the front of that screen, pull up your chat panel. Pull up your chat panel and see if you can click on that. Okay. And that CPT 2026 should pop up. You want to read the introduction section. Read that section. We already did this already, but I'm just kind of going backtracking for those new people. Okay. So in your CPT book, this is what you're going to go over. Okay. I'm saying it like y'all can see me. Okay, evaluation and management. Okay, we did that, but go over that. Go over, backtrack on some of those chats to see if y'all can catch up to where we are right now. Basically, I'm just flipping through the CPT so that you guys can make sure y'all should have already read this, but we might have new people in the class, and I'm just kind of put them kind of sort of in the right place. Okay, format of terminology. Okay, application submission. Category 1, yes. Category 2, you guys are supposed to have done that already. Okay, we did that already. I don't know, that was a chat we did a while ago. But again, we're just kind of going through the book. This is what you guys were supposed to do, which I'm sure you did because y'all already hanging out with me. Okay, in the advanced class. The guidelines, okay, specific guidelines are presented at the beginning of each of these sections. So in every section as in series, right, there are going to be guidelines. So every time you get to, let's say, a code or something like that, or a section in your CPT, there will be something for you to read. Now, the CPT, years ago, it was this small. The CPT book has grown, okay? You need to take more time. So when we do our hour and a half theory, your practice is home. Your practice is reading this book. Okay, your add-on codes, you should have read that. Some of the listed procedures are commonly carried out in addition to the primary procedures performed. Your add-on codes, remember, that's the plus. Okay. Your modifiers, a modifier provides the means to report or indicate that a service or procedure that has been performed has been altered. I know we went over that, but I want you guys to still study that. Remember, the gist of you passing your CPC is knowing your books. Knowing your books. Okay. If you guys don't have my schedule, okay, look at the chat and it's going to help. The schedule is going to also help you follow. Okay, it's going to help you follow. Like for Christmas and winter vacation, and you don't see me for like a week or so, or you don't see me a couple of, that's because it's on the schedule. Okay. I figured, like I said, I figured out a way to upload stuff to y'all. But I did give y'all a schedule. Okay. Um, with when we're in class and when we're not in class, XYZ. Like today, there was no class today. I'm just doing the YouTube for you, not for y'all. Y'all is Monday, Friday, and Saturday. I'm talking about Sapphire Academy. Okay. All right. So let's move on. Let's move on. Y'all know how I get thrown off. Okay. Place of service and facility. Unlisted procedure or service. Category 1 and Category 3 codes describe the vast majority of procedure and services currently performed in the United States. Now, do I want you to read that? Of course I do. Because what if they give you a question on that? Okay. Special reports, interpretation. Yes. So this is just your first beginning of you hitting your book. Time. The CPT code set contains many codes with a time basis for code selection. Okay. Code symbols. On the bottom of your book, you guys could probably see code symbols throughout your book. Okay. Those of you who have the hard copy, I don't know if you'll see it on the ebook, but again, once you get your book, you'll see what I'm talking about. You guys can kind of backtrack on this. Okay. So again, we're just pretty much going through your book just to get you up to. We're going to stop at Integumentary. Okay. AMA resources. Yes, I want you to read those. Well, you've already read that. Okay. So in your CPT book, there are also prefixes, suffixes, and root words. We did go over this in medical terminology because there is a section in medical terminology with root words. Okay. Just make sure that you check it out. Okay. So somebody asked me a question about the illustrations. Illustrations are pictures. They're like, body pictures, body planes. Planes are how they split the body up. Like when you go get an x-ray and they split the body up and they use those little planes to put in there because they don't want to have that side taken or they want that side taken. That's like an illustration. When you go through your book and you see something that says illustrations, that's what they're talking about. It's illustrations by anatomical site. Okay. Let me see this one real quick. Hold on. So, again, illustrations are a part of your exam. Okay. The good thing about that is that the illustrations are already in the book. Okay. But again, that's you knowing your book. You know what I'm saying? That's you knowing your book. Hold on, let me get this on. And that's the reason why we go through the book. I don't know what that is. All right. Good. That's what I want. I'm trying to make going on now. I'm trying to get up just other tests for you guys because all right, so Trina is asking me about medical billing. So I have a test for medical billing too. I just haven't put it up there. Well, after this, I'll put the link up there for a medical billing test. So don't forget the medical billing. I'm assuming she wants me to put the book up there, so I'm gonna put the medical billing book up there. Okay. So all right. So this is medical billing. So some of you guys who want to do the medical billing here, hold on. Let me put it up there. All right. And again, you don't have to get all these books at one time. Okay. Don't get all the books at one time. They cost too much. All right. Where we're at. All right. So there's the medical billing book right there. I'm going to also put up the workbook for that. So if some of you do not want to take the full coding class, you can just do medical billing. I'll just put the books up there. Those medical billing books have a short section in it for ICD-10. Okay, are they both there? Yeah. So that's the book, and the other one is the workbook. Open up your chat panel, you'll see it. The medical billing does have an ICD code in there. ICD code, HICS, PICS, and CPT is also in the medical billing. It's just a small introduction. It's not like a drawn out code out class that we're doing right now. This is different. Okay, this is a full coding class. Okay, if you just want to do medical billing, then just pop open the medical billing chats. When you go to the free coding, the medical billing chats are going to say MIB. MIB. The coding chats say CDG or SPC. The medical terminology course says MT. Okay, so let me put this back up here. Okay, so I'm going to hide that out. I need to put that. I'm going to put the CPT back because some of y'all might not have your book. Okay, so that's the CPT 2026. You guys can click on that side panel and get that. Okay, so I can't do 20 things at one time. You guys just let me know what book y'all don't have. I'll go ahead and put it up there. But I want to show y'all the planes. So anybody who's just joined this chat, this is your advanced class, okay? I don't know if you can see it. Let me find it and try to put it in there. Boop. All right. See it? Okay. So those are illustrations. That's what I was trying to tell y'all about. Okay, those are illustrations. All right. So again, those of you who do have your CPT, this is what we're doing. You going through your CPT so you can see what's in it. Okay. I am now at page 1 of the CPT book. Page 1 of the CPT book. Okay. Evaluation and management. We did already. Okay. Y'all had your review of evaluation and management. Okay. Remember in step by step. Now is your evaluation and management in your CPT guide. Okay. CPT book. Okay. So evaluation and management, your E&M services guideline. Remember what they said. There are guidelines at the beginning of every section. Okay. And in your evaluation and management, we already went over it, but now we are going to your CPT. Okay. As you guys can see, this is everything that we went over with the step by step, right? New patient, established patient. Okay. Established patient 99211 to 99215. If a patient is diagnosed with 99215, procedure code is 99215, where should the doctor be sending this patient if the patient is sick like that? To the emergency room. He better be admitting them to the emergency room. If he does not admit this patient to the emergency room with a 99215, I will not give him that code. I'm going to knock it down. Okay. So if you've got a doctor and he's using that 99215 and that doctor is not going to the hospital, that patient not going to the hospital, then something's not right. Okay. We got to help him choose the correct codes. Okay. New patient 99202. Okay. We went through all of this. I'm just kind of putting you where you should be studying. Okay. Because this has got to get you up to where we are. Okay. That's evaluation and management. Okay. All of the guidelines and evaluation and management you should have done. Okay. Because we did this with the step by step. Okay. Because the books that I gave y'all, the ebooks, this whole beginning should be in there. Okay, until you get your book. Okay, I would prefer you guys get the hard copy. Okay, new, established, split, shared, visit, history, examination. We did all that already. Multiple evaluation, management services on the same day. Y'all remember we do that? Okay, remember we do that. Exactly. The only thing now is you are now going over your CPT guide. So we've already went through the step by step. So now you are familiar with what you are looking at in your CPT, right? The step-by-step book, okay? So this is now your CPT book. Guidelines for selecting level of service based on medical decision-making, we've done already, okay? If some of you missed that, go back and get that check, okay? It seems like a lot because I'm just kind of going through the book, but it's not. It's just we've already did it already. So there's a portion in here. I'm on page 10. Okay. I'm on page 10 because y'all know I usually use my ebook, but I think it's almost a little bit better for you guys for me to use the hard copy. So that's why I started using the hard copy today. Okay. We kind of dabbled in it last week, but we're going to start looking at it like this. Well, I can still pull up the ebook. Okay. So medical decision making, we did that already, but I'm on page 10. So y'all should be going over that. Okay. We did the step-by-step in all of this: moderate decision making, high decision making, extensive. We did this already. Now, and you have your CPT book. Now you have to look at your CPT book and review what we already did in your CPT format. If you guys can see the language of medicine book, the step-by-step book, the CPT book, the CPC guide are all complicit. They all have the same format. They all have the same format. So the same way how the CPT is formatted, that's how your schedule is formatted. That's how I teach. I teach from the formation of the CPC guide and the CPT book. Okay. So we did this already. Okay, that's evaluation and management, risk of complication, morbidity, and mortality of the patient management. We did that already. But you guys go over your book. Okay, guidelines for selecting level of service based on time. Evaluation and management was a long class. What do we have? We had like 10 classes in that, right? Yeah, because evaluation and management was very long. So when you guys, those of you who are new to my class and you get to evaluation and management, look for evaluation and management. The class for evaluation and management is EMC 5000 was your capstone, right? Evaluation and management is EMC 6101. That's the class for evaluation and management. Okay, so when you go look for that in the coding module, all right. I know they call them playlists, but we call them modules. Look for the coding playlists, and then you're going to look for that class, okay? I know, I'm telling you. It's the same thing. So what we say modules, they say playlists, okay? Evaluation and management. Okay, so here's evaluation and management. We talked about telemedicine, remember? Now you're going through your book. So this is yours homework, okay? Hospital observation and services. Did we go over that? Hospital inpatient observation care. Okay, what you're going to do is use your classes that we already did and combine them with your CPT book. Okay, so how we do the advanced classes, you have your book, your CPT book, your CPC guide, and your step-by-step. Okay, that's your advanced classes. But what we are doing right now, because we've already went over the step-by-step, you guys were supposed to go through your CPT book page by page. That's what we're doing now. Subsequent hospital inpatient care, we've already done. Hospital inpatient observation, we've already done. So what you're going to do is read this section. These are like the guideline sections. So this is kind of to get you used to the guideline section. Open up the ebook that I gave you right there and just flick through until you get to evaluation and management. You don't have to be on the page that I'm on. I'm just kind of showing you what I'm showing you. So right now I'm in hospital inpatient observation care services. We did that already. We did that in step-by-step. But here, I want you to read that section. The following codes are used to report hospital inpatient observation. What you're doing now is getting used to the CPT book. The CPC book, the CPC guide is going to test your knowledge on this book. That's what the coding is about. We are going to test your knowledge and what you know. The more you look at this book, the more you will feel comfortable in passing your test. Consultations. Okay, we did consultations. When you get, I'm on page 24. You have a different book in your ebook, but it's totally different. But I still want you to go over this because, again, we did the step-by-step book, and we're just kind of going over this together. When we do finish the integumentary system, we're still matching it up with the step-by-step book. That's why I still got the step-by-step book up there, okay? Emergency department, we did that already. New or established patients. So go to evaluation and management, and you'll see some of that in there. Critical care services, we did that already. So in the step-by-step book, it shows you, the step-by-step book shows you how to do the coding, what to look for, or what you might miss, what you should highlight. Okay, now you're in the actual CPT book. Okay, so some of you who missed those classes, okay, just backtrack on those classes. And like I said, this CPT book used to be just it's like this now. You can't even hold it. So now you guys know why I like the ebook. But I have to have the hard copy so I can tell y'all what I need. Okay, so critical care services we did, but you guys are going to go over the critical care services, okay, in the book. So critical care is the direct delivery by a physician or other qualified healthcare professional of medical care for a critically ill or critically injured patient. Okay, I'm on page 28. And again, Amazon has a CPT book for it was $69 for the 2025. You guys can take your test with 2025. Yes, we said we prefer you to do 2026, but how much is going to change? Okay, if there's anything that's changed, all you're going to do is buy the CPT changes, like $5. Okay, but you'll save about $60 with 2025. Okay, but yes, we prefer you to have the new book when you are taking your exam. Okay, nursing facilities, we did subsequent nursing facility care. Okay, go back over those, and you guys are going. I want you guys to, when you do go over the E&M, just kind of look at some of the codes: 99316, 99345, home or residence. Just take a look at them. You're just kind of getting used to them. Okay, because you did have evaluation and management to code, face-to-face evaluation and management. I didn't realize the section was so big. I guess that's why it took us so long, because it looks like they added more stuff in this book. So like years ago, like I said, the book used to be this small. The CPT book is huge, and that's because they've added more procedures, they've added more description. Preventative care is monstrositous. I mean, I've never seen so much in this book. The ebooks are so much easier because I just kind of glide through them because we're teaching on the ebooks. Okay, y'all. So, okay, I'm not going to go through this whole thing, but just make sure that you guys go all the way through the E&M. Okay, go all the way through the E&M because we're going to backtrack. We're going to backtrack. You see that test up there? If you can't do that test, then I need to give you more. Okay, if you can't pass that test, I need to give you more. The link on that test is below. Okay, the link for that test should be below this chat. Let me show y'all this. I'm gonna try to show y'all this. Y'all remember when I had told y'all there's notes in the book. So see that note right there? I don't know what this is. Yeah. See that note page? So the proctor is going to look at your book. She's going to look at your book. Okay, but you can put notes on this page. There are a couple of pages in here like this for you to put notes on. Okay, so no, don't go writing 10 paragraphs. Just write some of what you need in there. Okay, anesthesia. Okay, because before we get to the surgical section, we need to be Paul on this. All right. All right, so anesthesia, we did anesthesia already. Anesthesia is on page 67, okay? So remember, anesthesia has guidelines as well. You guys missed that chat, go back and get that chat. But again, if you have your CPT book, okay, that's what we're backtracking. We're just kind of going over some of what we went already in anesthesia, okay? Don't forget, MAC is monitored anesthesia care, okay? Yeah, because in Medicare has also MAC, so be careful with that. Okay. And again, as you guys can see, I'm in anesthesia section. Y'all should be in anesthesia section. This book is by anatomical site. And when I say anatomical site, this is what y'all going to get used to. Because guess what? When you get ready to do your coding, you're going to find out what I'm talking about. Anatomical site, head, neck, thorax, thoracic as in back, chest. That's what I'm talking about when I say anatomical site. That's how the book is developed. So every section is going to be in the same anatomical site. Upper abdomen, lower abdomen. It's taking you down. Pelvics, taking you down. Knee, right? So that's anatomical site from head to toe. Okay. So those of you who are looking in your book, that's what they mean when they say anatomical site. All right. So in anesthesia, we've already passed that. Okay. Well, yeah, I'm still going to go over it, but we're getting ready to hit the surgical section. But I want you guys to make sure that you got it. Okay. So today we're going to officially hit that section. Let me take this down. But again, if you guys don't have it, drop that book. It doesn't make a difference if you're in my class, out of my class, or whatever. You can use those books. Okay. Hide. Okay. So surgery guidelines is on page 80, and we've already done that in the step-by-step book already. So that class is already passed. If you guys missed that class, go back and get that class. It is SPG6000 is the capstone, SPG8515 surgical guidelines. Okay. And again, I have to figure out another time for you guys to actually go over that. If you guys don't have your book, let me know. Look below. The ebook is down there. Okay, so here we are. We already at integumentary system. All right. So in the integumentary system, okay. Let me put this up. Okay. I'm gonna also get at that part. I could do it better on OBS, but when you guys get to that, this is where we're at, y'all. We just went over. This is where we're at. Okay. That's where we're at. Okay. Y'all know I normally use the ebooks, which I still do use the ebooks. I'm going to look at it in a few minutes. But I just wanted to make sure that you guys went over that first portion in your CPT book. Okay. If you don't have this schedule, go back and look at one of those chats. Go to my website and look at this schedule. Okay. Go to my website and look at this schedule. Okay. I'm going to put this schedule on there. If you want this schedule, I'm going to have to give you permission to do it. I'm going to unlock it for you to get it. But I've had it up there for a while. Took it down and put a different thumbnail. So in this schedule, this is the same schedule you should be following. So we are on integumentary. So let me pull up my step-by-step up. All right, hold on. All right. So we just went over the first portion of the CPT. Okay. Valuation and management, make sure you catch. Okay. Anesthesia, make sure you catch. So that's what you should be going over. We just went over all of that. Okay. So now, and also those of you who missed surgery section, you guys go ahead and go over that. Introduction to surgery section we just did. We talked about the notes and the guidelines. Okay. Like I said, every section has notes and guidelines. So I'm on page 83. So in all of the surgery guidelines in the front, you'll see where they have like a little note up there. I know all of you have your book. You can see it. The following is a listing of heading and subheadings. You remember we did the subheading and subheading with step by step. So if you don't have your step by step, go get it.